fiscal year 2026, more than 25,000 residents are expected to lose access to Medicaid. What is your office's plan to support those impacted?
We have I think, a fairly robust plan. We identified several goals when we were approaching the need to cut actually $182 million out of the budget on the Medicaid side. And one of those goals was to reduce eligibility by focusing on those on the highest eligibility income thresholds, and those who would have options for alternative coverage on the exchange, which is run by the DC Health Exchange. There are two programs that persons who lose access to Medicaid can access on the exchange. One is called the Basic Health Plan. It is being developed as we speak by Mila Kaufman and her team. This will allow people who are basically whose income is between 100 and 200% of federal poverty to access a program that they will design to mimic Medicaid in many instances. It won't be precisely the same benefit structure, but it will be very close. And then the others, and that's about 90% of the 25,000 who will lose access to Medicaid. The remaining 10% will be asked to consider securing insurance on the health exchange, where they also get a subsidy to moderate the impact of the cost of premiums. So we believe that the 25,000, slightly over 25,000, will still have coverage through the exchange.
Okay. And how did y'all determine who would lose access to Medicaid?
It's a long process. We looked at, as we always do when we are forced to make reductions, we look at three aspects of the Medicaid program. We look at eligibility, we look at the benefit structure, and we look at provider rates. Those are what we call the three pillars of Medicaid, and if you have to make significant reductions in the program, you have to do it by touching some combination of those three. We still recognize that we would have to have a program in place to serve, still over 250,000 people, and so we didn't want to reduce benefits so dramatically or cut provider rates so extensively that you would sort of vitiate the program for those who would still need it. So we said, well, how do we get to 182 million in savings? We said first you have to look at reducing eligibility, and if we're going to reduce eligibility, how do we do it? We do it by going to the highest incomes based on the eligibility guidelines in DC, and we go and then we focus on people who would be able to gain coverage through the DC Health Exchange.
And you mentioned the DC Health Benefits Exchange. Is this a health care plan? Or explain more what this program is. Are people automatically enrolled in this if they lose coverage, or how does that work?
No, we will try to do a warm handoff with the exchange. We've already identified the people who would be subject to the reductions. And of course, the council has to deliberate and pass the budget. If the council passes the budget, then we will transfer the data to the exchange that is needed to further identify. We will conduct a significant outreach program to those persons who are impacted, and then we will lay out for them the steps that they can follow to gain access to either the basic health plan or or a qualified health plan on the exchange.
So young adults between the ages of 19 and 25 have some of the highest rates of being uninsured, and according to the DC representative, he mentioned that those between 21 and 26 are being removed from the DC Health Alliance. Can you expand about this decision, if that was part of this, and why that was made?
Yeah, the DC Health Alliance is a program that's been around since before I came to DC. I came in 2011. The cost of the program in fiscal year 26, if we did not make any reductions, would be $250 million for roughly 37,000 people. With that kind of cost, it's a cost that has increased since 2011 on the expenditure side by more than 385%. Meanwhile, the beneficiary level has not grown considerably. The city could afford that program during the period when revenues were growing extensively and we had surpluses. Well, now the CFO has informed us that we're going to lose $1 billion in the next 4 years off of expected revenues. And the Alliance program is one that we can no longer afford to pay for at a clip of 250, almost more than a quarter of $1 billion. So we made the decision to do a number of things with the Alliance program in an effort to reduce the cost but also preserve as much of a benefit as possible. We have moved the program from managed care to a fee-for-service environment. That will save money. We have changed the registration requirements to match what the federal government is proposing to do with Medicaid. And we're freezing enrollment. We're saying if you're in the program and you stay in the program, you're fine. But if you leave the program, you cannot get back in. And there will also be no new entrance into the program, simply because at this point, with the cost being, again, over $250 million, we have to make some changes.
You mentioned the basic health plan that's being developed. Do you have any time frame of when we'll have details on that?
Well, that program is being developed by the exchange under the direction of Mila Kaufman, and she can best address the steps that they will take to make sure it's done in time. We fully expect the program to be ready, hopefully, and get CMS approval before the beginning of the next fiscal year. So there will be a lot of work done between now and October 1 to stand the program up. But Mila could speak to that a lot better than I could, because she has her team working on it as we speak.
The people that are losing Medicaid are often those in underserved communities with little access to technology. They might not know what resources are available to them. So how does the city plan to help those impacted know their options? What's the strategy for that?
We have an extensive outreach program that we will engage. We will engage the stakeholders to help us, the providers to let the beneficiaries know that if you lose coverage to Medicaid, here are your other options. We will reach out to the beneficiaries ourselves. We will leverage our use of emails, our use of text messages, our use of snail mail to let them know, specifically targeting those who would lose coverage, to let them know what their options are moving forward.
And what should people be aware of if they need to find a new health care plan?
I think what people should do, if they have any questions about, if they receive a letter that says they are losing coverage on Medicaid, and the letter will specify what their options are to continue health insurance. If they have any questions about what's in those letters, they should simply contact DHCF, and we will make sure that a clear message is sent.
And you mentioned that tax credit for reduced premiums. Is that something that happens monthly, or how do people find out if they're eligible? Is that something anyone can apply for? It's
automatic. The health exchange has a system that automatically calculates the tax credit for the person when they apply. So the premium cost that they face will be adjusted based on the value of the tax credit. That's the beneficiary has to do little to nothing. It's automatically done in the system, and they will have several options on a monthly basis, or it can be done annually. But those things can be worked out when they apply through DC Health Link.
Will people be automatically part of the DC Health Benefits Exchange if they lose access, or is that something they have to apply in addition?
They will have to apply, but we will do everything we can to make sure they know how to apply, and we will help them as best we can.
And how challenging has this whole budget been? How challenging has it been to make some of these cuts?
Oh, this has been a very, very difficult budget. When you're living in an environment for the last, since 2011, since after 2012, where revenues we're growing by an average of 6%, and then on top of that, you were getting surpluses when the chief financial officer did a forecast. When you go from that environment to growth that is in fiscal year 26, the growth will be negligible. It will be, I think, less than 1%. Negative. I'm sorry, it'll be negative 0.5%. So when you go from that environment to a no growth scenario that extends across the 4-year financial plan to the tune of $1 billion in lost revenue, you have to make some adjustments when your cost in your city programs are growing at a clip that is much faster than the rate of revenue growth. So it's been very challenging in that respect. And it's very challenging when some of the largest programs that have to be adjusted are programs that provide human services and healthcare. Those programs are the second most costly in the city, second only to education. And when you have to face a huge reduction in spending, you have to include those programs or you will not be able to make the budget balance.
Now let's say Congress comes back and says we're giving you the budget back. Do you guys have a plan for that? Is there a plan for how to reorganize the budget, or are you guys just kind of playing it step by step?
Well, those are questions best presented to our city administrator and our budget director and the mayor. I don't envision a scenario where the Congress would come back and give us a budget with more money in it, but if that happens, that would be great. They could come back and give us a budget with less money in it, and that would be problematic. But those decisions are made by people other than me, and then I take my marching orders from them.
Is there anything else you would like to add?
No.
Okay, I think that's all I have for you. Thank you so much.